y'all. I know it has been a long time since I have posted and made a video, but I have promised myself that I would do at least a weekly update. So, just to recap, if you haven't seen my first video, I have what's called autonomic neuropathy, which I honestly don't know how common that is. Amongst people, I have never met anybody with it, but that doesn't mean anything because I don't have that big of a bubble of people. Anyways, so it causes dysfunction, neuropathy of your autonomic nervous system. So all the things that you can't control, that being your heart, your stomach, and your bladder being the main things. So I have issues and have had procedures and surgeries for all of those things, but what I mostly have been posting about is my gastroparesis. It's been awesome to watch other people out there with gastroparesis, and yeah, I would definitely love to talk to somebody who has it. I've never met anybody else with gastroparesis or anything, but it's really nice to be able to watch other people up here who probably have a really good understanding of, what it's like to go through this. And yeah, I just have a lot of questions for other people, but for myself, the last thing I said, I had been in the hospital since February, and I kind of lost my motivation in the hospital, and I decided to not record and do anything. I had some tough decisions to make. If I wanted to have a surgery called a pyloroplasty, which you can Google that, or fast man version. Basically, if you know the anatomy of the stomach, they go and cut your pylorus laterally, and then they sew it back together to widen the hole. If your gastroparesis is bad enough, you have pyloric stenosis, which was something that I have. So the pylorus of my stomach just was strictured, and I would have procedures every 3 months to get it stretched, and Botox, which can often help keep it open, but that wasn't working anymore. So needless to say, I decided to go with a pyloroplasty. My doctor personally recommended having the pacemaker, gastric pacemaker. I don't know how many of you are familiar with that or heard about it, learned about it, got offered it, have it. I personally did not want it. It's supposed to help with more maybe mild cases, or people that have gastroparesis but maybe don't have as much vomiting but have really bad nausea. I have both, but I already have an implant. I have already 2 implants, and I just could not. I did not want another one, at least not right now. If it gets to that point, then so be it, and probably a lot of you will dislike me for saying I'd rather take a pill, but I'd much rather take dissolvable Zofran for some nausea, because that's what works for me, than have an implant 24/7. Because in hopes, the pyloroplasty it's just a palliative procedure. It actually doesn't cure gastroparesis. There's no cure for it. There's lots of different medications you can take and try, and yeah. So before I tell you the last part of my hospital stay, For those of you who are familiar with gastroparesis, you can try things like erythromycin. I have had it, but had to get cardiac clearance because I have cardiac history, and they couldn't even get it in the form that we needed it, and it didn't work for me. You can also try drugs like Reglan, which I don't tolerate. It can often make people feel anxious or cause a lot of anxiety. Compazine can do the same thing. Those are also anti-nausea medicine or antiemetics. So I'm unable to take those, so that's not a real option. Also, domperidone, and that is a medication that is not FDA approved, but you can order it online, and tried that, and that was also unsuccessful. There is also a medication that is not FDA approved that one of my doctors told me about. It's mostly for people that have small bowel issues, small bowel paralysis, or large bowel paralysis, so lower GI problems. My gastroparesis, because of the autonomic neuropathy, is not just in my stomach, so it's down to about a little bit more than halfway into my small intestines. So the only problem with this drug, it was FDA approved, but was only on the market for about a year or two, but it caused QRS prolonging. So if you're familiar with anything cardiac, the electrical part of your heart has a P wave, Q wave, R, S, and T. So that's exactly what you see, the little bump, and then the drop, the point, the drop, and then a final hump. And so it can kind of prolong that, which caused which can be fatal. And so that's actually what this drug did, is it, I guess, was causing too many fatalities. So the FDA pulled it. I was told by several doctors that it would be okay to take if I could get it out of the country. And I had doctors that said that they would order EKGs and follow me cardiac wise. However, I wasn't interested. Even though I said, I'd rather take a pill for nausea. I'd rather take one pill for nausea than try to take 5 different medications for my stomach. So I was going to show you guys all the medicines that I was on prior to having the pyloroplasty, which I was extremely skeptical about. But I think so far, it hasn't been a month yet, but I think so far I'm happy that I did it. I'm definitely better than I was before surgery, but I've had a few issues, so it's making it a little bit hard, and I had some complications after surgery, but for the most part, I'm at least putting food in my mouth. So that's a good thing, but we'll get there. So I just was going to show you some of the medicines. This is my medicine lunchbox. It has a lot of medicines that I don't take on a daily basis, but if I feel like I need to take stuff, then I will. So let me just pull out what some of this stuff. Yeah, like I threw some melatonin in there, which I don't really take melatonin anymore. I found that it just wasn't really working that much for me anymore. So let's see, where are my scopolamine patches? They fell out of their little bottle. Some of this stuff I don't need to show you guys because it's for some other things that I had, or I have going on. But, so, this is so ridiculous. Okay. And I know that this is like not even bad compared to a lot of people, so I should be very thankful, which I am. But I have good news to come out of this, so that's why I want to share it with you guys. Okay, so just sticking to just GI meds, I have Carafate. So that was something that I was taking on a daily basis, twice a day, or really it's like up to 4 times a day. I was taking about 2 mostly, depends. If I ate something that didn't agree with me, then I would take more. But the good thing about Carafate, I don't know if anybody else is on it, but the good thing about it is you are able, it's kind of like a liquid Band-Aid. So in the hospital, they have it in liquid form, which is great. So if you're having any acid reflux or been vomiting a lot, it kind of soothes that. So that's really good. But the good thing about it, having it at home, is you are able to crush it and put it in water or Gatorade or something. I put it in just a little bit of water, so it was kind of chalky, but it did relieve a lot of my symptoms if I was having like prolonged throwing up or had eaten something that just like didn't sit right in my stomach. Also promethazine, so Phenergan. I also have this in suppositories, so when I was throwing up a lot, I was unable to hold any pills down, and this was before I had both my tubes, so yeah, that was fun. I try not to take Phenergan a lot. It kind of is in the family of Reglan and Compazine, so I didn't love how it made me feel, but it also knocked my butt out. So really getting on a bender of throwing up, it did allow me to sleep longer periods without throwing up, but I also don't like spending my time just sleeping because I care about quality of life. But that's just me. Okay, these are not related to belly stuff. Not related. Oh, omeprazole. So these ones are the capsules, so it has little beads inside. So I was taking this. This was twice daily. So I was taking that. And then also taking the Protonic, so the pantoprazole. This was just, let's see. Oh yeah. So how it's written on here, whatever, that doesn't matter to you guys, but basically it was twice a day as well. So the omeprazole and the Protonics twice a day. And then if my vomiting got really, really bad, and I definitely, oh, where's my Zofran? Okay, so Zofran, I have this in both the dissolvable and, where did the other bottle go? Let's see. So this one's the dissolvable. I have it. They kind of all came out, but it's all the same thing. So the dissolvable are these two. So I don't know if anybody's had the sublingual. It just goes right under your tongue and dissolves. So that's usually, it kicks in like pretty quickly within like 5-10 minutes. And then I have just the regular pills that you just swallow. But again, if you're throwing up, it's not good to take pills and just barf them up. And then would take hyoscyamine, and this would be mostly just for like bowel cramps. So if I would get this really sharp pain in my stomach and in my bowels just from throwing up. Every time I throw up, it was like everything kind of contracted, which is kind of funny, seeing as though when your stomach's paralyzed, it really doesn't do that. But I would just kind of get these really funky cramps. So hyoscyamine for that. And then I believe that's it. The last thing that I would take, and I only have one part of it, I don't know where the other part is, but this is liquid lidocaine. So anybody who has ever been in the hospital and had a GI cocktail, if you ask your doctor for just 2% viscous lidocaine, you can buy over-the-counter Mylanta. I would just get like the generic version of it, like the Walgreens or Walmart or wherever store I was at. But I would do that, and I would just mix that with the lidocaine, and there is your GI cocktail. Now, for anybody who's ever had a GI cocktail, you know that they are not pleasant, but you probably also know that they work. So this was like kind of a lifesaver. This and the Carafate with the throwing up and just the acid. I don't know if anybody ever experienced like when I was in the hospital, I wasn't taking in anything and was just throwing up stomach bile, and it burns. I don't know if anybody has ever been that sick or had the stomach flu and knows what that's like, but it's less than pleasant. So the viscous lidocaine and the Mylanta over-the-counter is something great to have, and even if you don't really have bad stomach problems, but you do have heartburn and stuff, frequent heartburn, I know there's things like Zantac and Nexium, and Nexium I know like works because it builds up in your system. So yeah, the only thing I was going to mention to you is like the omeprazole. I know that I had mentioned it having beads, so for anybody who has a G or J tube, a G tube wouldn't really matter as much. I've had a GJ tube, which is the 2-in-1 spot, and now have a J tube and a G tube. So they're different. So the beads in that omeprazole that are in the capsules, they can't be crushed, and they can clog tubes. So that's why I just got the over-the-counter omeprazole. My insurance wouldn't cover prescription, whatever, which is all the same. Over the counter, it's the same milligrams. It's just dispensed by the pharmacy. So the pharmacy just pulled this off the counter and gave it to me and was like, you're going to save so much money. So, but the really nice thing was that I just told the pharmacist what exactly I was looking for, and her and my surgeon had tried to come up with every combination. They were trying to find an antacid that would work being crushed to put in my J tube, since everything has to be bypassed from my stomach. So anyways, now, so I just wanted to show you guys. I'll only grab one of the bottles. So that's 1, 2, 3, 4, 5 that I can hold. So there's these 5. And then 6, 7, 8, and then the Mylanta that goes with that. So basically 8, you could say 9 if you count the Mylanta. So 8 medicines that I would take just for my stomach for symptoms. Oh, I know what I was going to tell you guys. Also, I don't know where the rest of these are, but here's my carrying box. Scopolamine patches. They're the little, I don't see one in here. Oh, here we go. Oh no. Scopolamine patches are, I can't, find them. They must have all fallen out. They're just a little patch. It kind of looks just like a circular Band-Aid, but it's placed on the back of your ear, and it also helps with nausea. It's longer lasting, and it's changed every 3 days. I can no longer be on it just because, because of my heart issues. It was causing me some pretty scary heart stuff. So, sorry, I just heard this like really weird noise downstairs, so I hope it's nothing too scary. Anyways, so I guess you could say 9 medicines with the scopolamine patch, and I would wear them constantly up until the last week of my hospital stay. My heart was like dipping into the 20s and then would shoot up in the 150s, so which scopolamine patches can cause it, at least bradycardia. So obviously, having cardiac issues and a cardiac history, I was just more sensitive to it. But if you ever find yourself like needing it, I definitely would say that it works for me. So 9 to 10 meds that I would take for my stomach. And then, like I said, if things got really, really, really bad, I would take Ativan or lorazepam. And this, of course, makes me so tired. And it totally knocks me out. But it is used as an antiemetic. A lot of people have said in the past, or say that, kind of once you get into a cyclical vomiting cycle where somebody with gastroparesis, like, you throw up, you have to break the cycle. And sometimes having a benzodiazepine can do that, that's what Ativan is. Can help with anxiety about the situation. It's supposed to just relax you, but it is used a lot of times in chemo patients for vomiting. It didn't really do that much for me. It just knocked me out, kind of like the other stuff. So now, that being said, when I got sent home from the hospital, they put me on a couple pain medicines. They sent me home with liquid morphine. I don't know if anybody's ever had that. It was not for me. I really don't like taking pain medicine. It's really not good for people with gastroparesis. It slows your motility down even more. So if you don't have a lot of motility, and whatever you do have, you suppress it. Yeah, it's like just makes the situation worse. Also, it's kind of like a double-edged sword when you're in the hospital. At least for me, the pain was just so bad, so I was on IV pain medicine. I basically lived on IV pain medicine and IV antiemetics from February to June. But anyways, so I wanted to share with you guys that since surgery, I am now on one stomach med, and that's the omeprazole, which I have to take because of the surgery, so everything heals and the acid doesn't like erode into the sutures. And people that have gastroparesis, generally their bile that our body makes just kind of sits in the stomach for longer periods of time, so they are prone to have gastritis and ulcers more often. So the omeprazole, I'll have to take this the rest of my life, but if it helps, so I just take this. And since I'm still 2 weeks out after surgery, I just take a tramadol. I take whatever, it doesn't matter. This is an empty tramadol bottle, but the tramadol, and it says you can take 2 every 6 hours, but I only take one once a day, and I take it at night because I noticed I am unable to sleep on my side still, just because of my stomach, and I definitely cannot even lay on my stomach. So with a pillow, it just kind of helps me sleep better. So I just wanted to share that with you guys. If I could, I would be taking these guys, ibuprofen. It's like my best friend. It's so bad it's so bad for you. Or at least people with stomach problems. It can cause, if you have a history of ulcers, and that, you know, you're definitely supposed to limit yourself, but man, that stuff works. Gets rid of all my aches and pains, and generally helps my stomach when it's hurting. So, but after surgery, I can't have it for 12 weeks, so, yeah. Anyways, so I just wanted to share that with you guys, because I thought that was pretty cool. I went from having about, 9-10 meds for my stomach for any symptoms to now, like, I know I had mentioned, I've had some complications after surgery, so I do take Zofran. I take it maybe twice a week, 3 times a week, which is not that bad, considering I was taking it on the dot every 6 hours, and just 1 tramadol a night. So that's not too bad. I am happy about that. And then as soon as I can take that ibuprofen, I'm going to. So, now that I've said all that, I will hurry up and get through my next part. I know I talk a lot, because I almost just talked 30 minutes about medicine and sharing that with you guys. I'll make this next part not super quick, but I will explain some things, and then I'll make another video to just kind of split it up. So basically, I continued to be in the hospital, and just was having a really hard time. I wasn't getting any better, not feeling any better. I had some issues with doctors, and then basically the decision was mine of what the best situation and surgery was going to be for me. And like I said, I ended up choosing the pyloroplasty without the stimulator. My doctor obviously recommended that, but was also doing a clinical trial for that. And so it was kind of funny, because it was like Grey's Anatomy style. The clinical coordinator is the only person in the operating room that knows, opens an envelope, and says whether or not your stimulator gets turned on. So everybody in the trial gets the pyloroplasty and the stimulator, but then it's who's ever chosen to have the stimulator turned on. And you don't know, and then you don't know for 3 months. And then after 3 months, everybody's simulator is turned on, and then they compare and contrast results. So basically for me, I mean, it had nothing to do with the clinical trial, and it had everything to do with another implant and the complications of that. I also, in my situation, already had a GJ tube, which, for those of you who don't know what that is, it is a tube that is placed in your stomach, but has two ports. One port goes down longer. I know I explained this before, and it goes down into your small intestine, and the other one just stays in your stomach, but it's only one tube out of your body. And then it has 2 ports outside to use. Well, actually 3, because it has a balloon. But anyways, that being said, I was going to lose that tube if I would have had the stimulator placed. because already having a hole, it would have put me at a higher risk for infection. I also, as part of autonomic neuropathy, I have lupus, and don't have a great immune system as it is. So, another reason why I just chose not to do that. And so far, I'm not regretting that situation, but it's only been about 2 weeks, so we'll see. Anyways, so I had the pyloroplasty, decided to do that. Had a really hard time making that decision, was feeling like I shouldn't have surgery. I was really scared. I was really nervous. I didn't really see myself like an end result of, like, was it going to make me better? You know, I didn't really have like an intuition of which was going to be better, but as my time in the hospital progressed, I was tolerating probably one of the best tube feeds out there, and I say best only because it is less, I don't want to say less processed, because tube feed is tube feed. However, it's made in Boulder, Colorado, and it is a lot of, it's by Kate Farms, and they obviously have a different content and percentages, and obviously if you work with a dietitian, they let you know what they think is best for you based on your nutritional needs. But for me, I was doing the Kate Farms, which just has a lot of like veggies and fruit in it, and I was unable to tolerate that, and it was kind of already the most broken down formula. I was on IsoSource